Nickel titanium rotary instruments were introduced to the dental profession in 1995. In this new millennium, there is a third generation of nickel titanium rotary instrumentation manufactured by SDS Kerr. I've been using K3 now for about 3 weeks and I've found them better than most of the other systems I've been using, mainly because they're sharper, but also because when you place them in the canal they feel more solid. I've been using them with a gradual pushing them into the canal and coming out rather than a light pecking motion, still using very little force, but this solid feeling gives you the confidence that they're not going to fracture.
K3 is a new generation of rotary nickel titanium instrumentation. At Kerr, we took an engineering approach to all the design applications of the system, and working together with Dr. John McSpadden, we developed the K3. K3 incorporates a triple helical design with 3 radial lands, reduced surface contact, and a positive cutting angle. Coupled with this, we have a variable flute angle and core diameter, an easy access handle, a non-cutting tip, and a simplified color coding system. The design of the file and its positive cutting action means that it can be run at higher speeds to maximize cutting efficiency. The variable flute angle and core diameter give the K3 unparalleled debris removal and flexibility.
So now we're going to show you the K3 system, first in a plastic block, and then we're going to show you how it's used in the clinical situation.
Check that the canal is obstruction-free. Open coronal third of the canal with the K3 10 taper orifice opener 25 tip. Take the K3 08 taper orifice opener 2 to 3 millimeters deeper into the canal. Check the canal is patent with size 10 K flex. Use K3 size 40 06 taper in crown down technique. Use K3 size 3506 taper. Use K3 size 3006 taper. Use K3 size 2506 taper. Use K3 size 2006 taper to the apex. A 37-year-old female patient was presented with toothache in the lower right 6. Symptoms were sensitivity to hot and cold and pain on biting. Her general dentist had extirpated the pulp and placed a dressing. On investigation, there was a fine fracture across the mesial wall of the tooth, but not across the pulp chamber floor. Rubber dam was placed and straight-line access to the canals was ensured. A size 10 K-flex was inserted into each canal to check there was an unobstructed pathway for at least half to 3/4 of the estimated canal length. Files were run at 300 RPM on torque level 3 on the K3 torque control motor. First, we use K3 10 taper orifice opener with 25 tip size to open up the coronal third of each canal. Now we take the K3 08 taper orifice opener with 25 tip size 2 to 3 millimeters further into each canal. Apical patency was established and working length determined by using the Kerr AF plus apex locator. Lubricant was placed in the canals. Now we use the K3 in a crown-down technique with light apical pressure as shown. K3 size 4006 taper in each canal. We then use the K3 size 3506 taper in each canal. K3 size 30-06 taper was used next in each canal. K3 size 25-06 taper was then used in each canal. Finally, K3 size 20-06 taper was taken to the working length in each canal. Apical patency was confirmed. The cleaning and shaping efficiency of K3 is very visible. Each file was used in the canal for 3 to 6 seconds with light pressure. Irrigant was introduced between alternate sizes. This technique is a brief outline for medium and small canals. The result achieved and subsequent obturation were very pleasing. The tooth was restored with a cusp-covered restoration.